Bansal, and today we are going to talk about total knee replacement and what you should know about it. A patient who wants to undergo a total knee replacement for an osteoarthritis of the knee needs to have some prior information. Firstly, and most important, is how bad is the condition of the knee, when he will recover, when he will be able to walk, how much stay does he need, will it be done through minimally invasive technique, how much will be the pain. Today we'll try to describe and give answers to all those questions. Typically, the pre-operative workup of a knee replacement involves carrying out couple of tests and x-rays which tell us exactly how bad the knee is and which implant will fit that person the best, along with the risks involved in the surgery. After having done a pre-anesthetic checkup and all the diagnostic investigations, we are able to reach a logical risk assessment, and then a knee replacement is advised. The surgery, as far as the minimally invasive surgery is concerned, the incisions of a knee replacement surgery has been decreasing every day, but there is no way by which a knee replacement can be done with a keyhole. There has to be some amount of incision, though modern day incisions are relatively much smaller, maybe a couple of centimeters. Deep tissues are cut in such a fashion that post-operative pain is very less because of that particular approach. Same day, the evening, patients are allowed exercises. Next day, the patient walks by himself, of course, with the help of a support. The support is carried out for another 3-4 weeks, depending on person to person, how bad was the condition of the knee and what are the other problems which were involved apart from the knee problem. Blood loss is usually hardly any blood loss is there. Antibiotics are typically prescribed for 5 to 7 days. Stay in and around the hospital, total stay which is mandatory should be around 10 days to 12 days, because usually the stitches are out by around 12th, 13th day, and then you are safe to fly back if at all you come from outside India. Typically, patient is quite pain-free after a week, and most of our patients, they are happy to fly in around 2 weeks time. So that's the kind of time frame we look at while we advise for a total knee replacement. You're able to do all your activities from day 2 except deep knee bending, like sitting in namaz posture or cross-leg sitting or squatting. That is to be avoided for lifelong preferably, but minimum for 6 weeks. Walking without support, usually most patients, they walk without support at around 4 to 6 weeks, and at the same time they are able to climb stairs and drive too. It is safe to drive after 4 weeks from the surgery. Every patient is a little different, so these time durations, they might vary a little bit. Sutures, the stitches which we use after the surgery typically are the skin staples, which are very easy, non-allergenic and very easy to take out. They hardly cause any pain. Modern day anesthesia has evolved a lot. Usually the process is very painless because of a special technique which we call as a epidural anesthesia, wherein a small tube is placed in the back and is connected to a machine which we call as a PCA, or a patient control analgesia machine, which delivers a fixed amount of drug into the spine so that the legs, the patient doesn't feel any pain. Most of our patients are happy going out of the hospital to either their home or a secondary care center where they can carry out a physiotherapy at around 4 days to 5 days after the surgery, in cases where both the knees have been changed together. And they are happy to fly out after around 2 weeks. Most of our patients are under regular follow-up via emails and via our video conferencing facilities, and they are very happy after usually around 1 month after the surgery. They complain that they don't have any pain, they are doing all their activities, walking fine, and even start to jog. Swimming and cycling are 2 exercises which are highly recommended after the knee surgery because they help improve the range of motion which we ultimately achieve after the surgery. Apart from that, physiotherapy is important in that we help in collating with the local physiotherapists. Also, we've set a protocol as to which day, which type of physiotherapy has to be done so that the patient achieves a maximum range of motion. So in total, a knee replacement involves an investment in time of period for around 4 weeks, 2 weeks stay in India, and 2 weeks after that in the native place wherein physiotherapy has to be carried on. Usually after a month, people are back to their normal activities.